Hi, thank you for having me here. My name is Stephen Bloomstein, and I'm president of the Turi Mikire Foundation, and which offers community-based family planning and rural education and development services in rural northeastern Venezuela. And as many of you may have heard, Venezuela is a country which is suffering kind of chronic humanitarian crisis, where many of these basic social services simply are not available. So I'd like to put up some slides because I think that's the best way I can tell our story. I'm going to start that now. Hang on a sec. So are these slides up? Can you see? So our story is unusual in that we started grassroots in the 70s. We were a small group of college-educated, non-professional North Americans who, in the spirit of the 1960s, we had moved to Venezuela in the early 1970s to practice tropical fruit farming and live close to nature. And of course, what happened, we soon became very involved with the poor rural populations with whom we lived and worked. And what we saw in those days, rural campesino women frequently had up to 8 living children by the time they were 30 years old. They often started giving birth as young as 14 or even younger, and often including several miscarriages or infant deaths in the process. High levels of maternal and infant morbidity and mortality were, and in fact still are, a fact of life. Women went for years and years without having a menstrual period, having one pregnancy following another. It was what we called a reproductive treadmill and a serious, vicious circle of poverty, really. So when we asked these families what we could do to help, the women overwhelmingly asked for family planning for themselves and for their daughters. They were very clear that this was the most urgent and empowering assistance that we could offer them. So we started to help out of our own resources. But then our friend and neighbor in the valley, Brunilde, died in 1994 from postpartum hemorrhaging after giving birth to her 7th child at the age of 31 in a small mud hut 2 walking hours from the nearest road. She bled out while being carried down rocky foot trails and across mountain rivers in a blood-drenched hammock in a desperate effort to attempt to get her to the road and then to the local hospital in time to save her life. Her newborn died shortly thereafter. And that became our wake-up call to do something more, to start our foundation. Once we got going and began to offer family planning, first everyone in our valley, then in neighboring valleys, the demand was just huge. It was tremendous, word by mouth. We grew very quickly. We quickly learned our second lesson, that once women and families gain control of their fertility, they immediately turn to education as the next step in improving the lives of their families. So parents who might be completely illiterate themselves are passionate about giving their children the best possible future through schooling. They know that education is the key to their children's future and to developing their community. And so this is how we evolved our 4-step recipe for community development, which we call our recipe for a thriving community. Family planning, first. Offer women and men the ability to control their fertility to have the children they really want to have. Second, education. Offer families real educational opportunities for their children. Third, community. Support and build infrastructure and sustainable livelihood. And fourth, humanitarian aid to provide critical assistance for those who fall through the cracks, the poorest of the poor. So here's our results, some of our results in brief through 2022. We now work throughout our state of Sucre, and often women come to us from neighboring states. We've offered 71,000 and more women and their families safe, reliable family planning. And that amounts to almost 240,000 couple years of protection the metric by which USAID measures family planning achievement. We have 80,600 participants in reproductive health workshops. It's like family-based, community-based sex ed courses teaching young people about their sexuality and their reproductive health. And we increasingly practice humanitarian medical services. We've had over 6,800 other services in primary and secondary healthcare as the situation in Venezuela continues to deteriorate. We have hundreds of student graduates from high school and a few going on to college with the foundation's support. And some other community activities too, you can see briefly on the list, but we can't really go over them all. So how do we do this? Well, we feel we have an efficient and replicable service model. We operate always on a shoestring budget. We do not build new infrastructure. We always partner with existing public and private facilities. Our service team is 100% Venezuelan and 95% women, ranging from medical professionals, doctors, nurses, sociologists, social workers, educators, all the way to campesinas, rural women in the field. And we practice social marketing. All services are offered at way below market cost, but no one is turned away if we can help. Even the poorest are given the help they need if we can possibly do it. So here's Marcella in pink. We're showcasing her here. She is one of our earliest and longtime staff. She started as one of our first high school scholarship students, one of our first college graduates, now a certified employed public school teacher who coordinates our education and family planning programs in where we all started. An example of what this kind of empowerment can offer and across generations. Finally, I'd like to say that there are millions and millions of women around the world. It's hard to know really how many, and hundreds of thousands still in Venezuela, who do not have access to adequate family planning and cannot control their fertility in what is often a patriarchal environment. So I believe this is a human rights issue, really a question of freedom, of empowering people to freely decide their own reproductive destiny. Thank you.